You feeling sick, or do you even feel like you have a sniffle coming on? You are not alone right now. Mid-South doctors say that we are in the thick of respiratory virus season.
Nobody needs that right now. With the holidays behind us, your chance of getting sick is only going up. Fox 13 health reporter Mandy Rock is live outside of an urgent care clinic in East Memphis. Mandy, you talked to doctors. They told you this season is shaping up to be worse than last year, and it's not even half over yet.
Yeah, it certainly seems like everybody knows somebody who is sick right now. Just within the short amount of time that we've been here outside this clinic today, we've seen several people wearing masks going in and out. We even talked to a few people who said they were getting tested for flu and COVID.
There's a lot of hand sanitizer going on and a lot of vitamins.
As the holiday season winds down, virus season ramps up. Folks like Satina Maller are playing it safe.
Actually, there are two people that were sick in my office, and so I decided to come out into the parking lot and do some work, so remotely.
This map from the CDC shows all 3 Mid-South states are seeing very high levels of flu-like activity. Dr. Steve Threlkeld, an infectious disease specialist at Baptist Memorial Hospital in Memphis, said hospitalizations for flu and COVID at his hospital have nearly doubled in the past week.
Right now in our hospital, we have 37 people in the hospital with influenza and 30 with COVID. Just in this building, and that's getting up there.
While flu and COVID are the main culprits, Dr. Threlkeld said other viruses like RSV are continuing to circulate. While it's not unusual to see more sickness this time of year, he warns the worst is likely still yet to come.
The flu, particularly here in the Mid-South, can stretch out into February and March regularly. Well, right now we're sort of in the middle of the rocket rise, so I don't think we reached the top. I think it may be 2 or 3 more weeks before we really see that.
If you're feeling sick, Dr. Threlkeld said it's important to know what you have so you can get the correct treatment.
It's very important to get an early diagnosis because these antivirals for influenza and COVID are quite effective, but they have to be taken really early on.
Maller has some advice for people wanting to stay healthy.
Just be really cautious. If you can wear a mask, wear a mask. If you have hand sanitizer, most definitely use it all the time.
And of course, the best way to protect yourself, doctors say, is to get your flu shot and your other vaccinations. Now, if you haven't gotten them yet, it is not too late. And coming up at 6, we're going to hear from a pediatrician about what's circulating among children and what the risk is now that those kids are back in school. Daryl?
Fox 13's Mandy Rock live in East Memphis. Thank you, Mandy.